How long does it take to recover from septorhinoplasty? It's about 7 to 14 days, depending on what you're having done and what your surgeon does with the splint and with taping and so forth. I tell people if you have 2 weeks, you will be just fine to go back to work. The way I do it is I put a metal splint on for 5 days and then tape on the nose for another 5 days. So you have 10 days with something on your nose. And once we take that off at day 10, you're able to put on makeup, you're able to go to work, you're able to do your normal activities. So in general with my rhinoplasties, it's about day 10 and you're able to go back to work. Unless you don't mind having tape on your nose, which some people don't, they work from home, they don't mind. And in that case, after about day 5, you feel fine. You just have tape on your nose. And any bruising and swelling that happens around the eyes, a lot of times around that day 10, it's gone or it's so minimal that you can cover it with makeup and it's not really that big of a deal. How painful is septorhinoplasty? Septorhinoplasty is usually less painful than what the patients think it will be because you just don't know what to expect going into it. There are actually studies looking at how many pain pills patients take after septorhinoplasty and does that correlate to how many we give them. And usually it's about half of the pills that we give. So it's not as painful as we thought it was, through our training. Most people say it feels like pressure, especially along here. It feels like a sinus headache where if you move, you can feel that pressure in your nose. The incision feels kind of stingy, like a cut for about 24 hours. And your nose may be stuffy, kind of like you have a cold. And the stuffiness lasts around a week or so. So in general, it's more discomfort, it's kind of annoying, but it's not, an intense pain. And compare this to, say, like body surgery, where it's an incision on your abdomen or something like that, where you move it all the time. It is way less painful than that. You don't really move your nose. It's more kind of pressure and annoying. How do you sleep after septorhinoplasty? We recommend that you sleep about 30 to 45 degrees elevated from flat on your bed. So that means add another pillow or 2 underneath just to keep your head above your heart. That helps the swelling go down faster and not have asymmetric swelling. If you happen to roll over and you're a side sleeper, you'll just notice the side that was down is a little more swollen that morning, but that's not permanent, it goes away. Usually people that sleep on their stomach don't have the problem of sleeping on their stomach because your nose is tender. It's sore and it's not something that you're gonna bump in that first few weeks. Ideally, you sleep kind of on your back and so the swelling goes down more symmetrically, but I would prefer that my patients get sleep rather than sleep perfectly, upright in a chair or something like that. It doesn't make that much difference. It just really helps the process get better faster. Have questions? Call or email anytime. I help patients like you every day. I'd love to talk and understand what you're hoping to achieve. Thanks for watching.